June 23rd, 2020, we have 827 cases. We still are 29 deaths. One of those cases is currently hospitalized, 347 outpatient, 450 recovered, for a case fatality rate based on confirmed positive cases of 3.5%. We are still actively monitoring 20 people and have monitored 937. Monitoring is those who are exposed but not necessarily symptomatic. So our hospitalizations have gone down and stayed down over a lengthy period of time now, dating back all the way to really early May, when we saw the significant drop off, and have been at this number 1 for quite a while now. So we are right now 54.4% recovered, 3.5% deceased, 42% home. So they are still actively with infection, but are not needing anything other than staying home and taking care of themselves. 0.1% hospitalized and none in the ICU. So this is our curve, which you saw was getting nice and flat, and we'll talk a little bit more about what you see is a little bit of a letting go of that flattening. And you will see that too in our incidence curve, where over here at the end, you see cases that were reported. Really the highest number of cases in a single day we've reported since way back in late April. So our percent positives per day have been trending downward, but you can see a little bit of an increase here at the end of these last few days compared to the days before that in percent positives. So the number of tests given per day, how many of those are positive, which is important to track as testing increases. So when we look at those together, a rolling average, 7-day rolling average, which helps flatten that curve, we can see that we are experiencing this increase in the last few days, as well as an increase in positive tests, percent positive tests. If we look by zip code, we are still at 48911 is our highest prevalent zip code, and we've talked extensively about the demographics related to that. 48823 has now popped itself up. That is related to the Harper's outbreak that you have been hearing about to some extent. Under that is 48910, 48906, and so on. If you look at those cases in terms of just numbers of cases, with shading darkest blue, the highest number, and then going down from there, you do see that 48911 followed by the East Lansing 48823. But if we look at those by population, so calculating a rate, we still see that our 48911 zip code is our highest, followed by 48910 in Lansing and 48864, is that what it is, Mason? And then East Lansing, despite the increase in cases and the number of cases, a heavily populated zip code, still in a lower rate range. Basically a heat map throughout the county still shows the significant heat activity in 48911. The dot over there in Okemos is Ingham County Medical Facility, where we had an outbreak that has now been closed out. So we go 2 incubation periods beyond the last case, and then we close out that outbreak, which has happened with Ingham Medical Facility. If you look at a little bit more zoomed in version of that map to get you into the city and East Lansing, then you basically get a better idea of, you know, the numbers of hot spots we have, particularly in here as well as here, and then you see a couple over here in East Lansing as well. Our cases really right now by sex are split 50-50. By age group, we are now at 20% in the 20 to 29 age group, then followed by the 30 to 39, 40 to 49, 50 to 59, and tapering off on each end. I would probably guess, I haven't looked at all the raw data at this point, but that increase in the 20 to 29 age group is also related to the Harper's outbreak that you've been hearing about. As those numbers increase and the age range of those folks last I knew was 19 to 23 with a median of about 20 or so. If we look at cases across the county by race, 50% are Caucasian, 27% African American, 15% Asian, 6% other, and 2% unknown. So then we look at that by prevalence rate, once again adjusting for population, just like we do with the rates on the map, which basically takes every population to 100,000 and said if there were 100,000 of Caucasians or African Americans in any given population, how many cases would there be? Some cases you have to multiply, sometimes you have to divide to get down to that 100,000. So it's a per 100,000, 192 for Caucasian, 684 for African American, 640 for Asians, and 820 other. We look at that by ethnicity to see what's going on with our Hispanic and Latino population. And 84.4% of our cases are not Hispanic or Latino, 10.9% are Hispanic or Latino, excuse me, and 4.7% unknown. So that rate looks like this. Again, we have to, adjust for population where we are, don't have as large of a Hispanic or Latino population as a not Hispanic or Latino. So 258.8 compared to 390.2 is the rate difference between our not Hispanic or Latinos and our Hispanic and Latino population. If we look at deaths in Ingham County by age, and this hasn't changed because we haven't had a death in a while yet, so we are 13.8% 50 to 59, 17.2% 60 to 69, 27.6% 70 to 79, and 41.4% over 80. So clearly that 70 and above range is the predominance of the deaths in Ingham County, which holds true nationally as well as worldwide when we look at the deaths as a result of COVID-19 infection. By sex, we are 51.7% male, 48.3% female. By race, 62.1% Caucasian, 31% African American, and 6.9% other. By ethnicity, 86.2% not Hispanic or Latino, 6.9% Hispanic or Latino, and 6.9% unknown. And then probably what you're all going to want to talk about today is the outbreak. Anytime we have a number of cases in any particular area, we do basically designate it as an outbreak. The Harper's situation is an outbreak now within the Michigan disease surveillance system at the state level, as well as by us. That case count has changed even since the press release that went out this morning. We're at 18 cases associated with exposure at Harper's in East Lansing. Those people live in different places in the state. However, 12 of those are Ingham County residents. 1 lives in Barry Eaton. 3 live in mid-Michigan district, which is Clinton County, by the way, is in mid-Michigan. So it's Clinton, Gratiot, Mount Calm. So I'm going to guess those are probably Clinton County residents. And then 2 are Oakland County residents. And that is the end of data. So, questions?
Thank you, Linda. We have a question from Kyle Kaminsky.
Hi, Linda. How you doing?
I'm doing well, Kyle. How are you?
Not bad. I wanted to follow up on the Harper's thing. I read the press release. I know the inspectors, note that the inspectors didn't find any problems with safety procedures or protocols. Also know that you've talked a great deal about personal responsibility and from both customers and businesses, but I guess this sort of begs the question of what could have been done to prevent this from happening.
Well, any number of things. We've all seen the pictures of the line outside. People are, allowed to not wear masks outside, but in, gatherings are outside, and I would call that a gathering. It has to be under 100, as well as 6 feet distance between people who you do not share households with. So we didn't see that happen, or really any attempt to require that to happen. There was a sign about mask wearing, and it's very clear from the pictures that that didn't happen. So, I think we have to do something about, lines that form outside of places like that in order to get in. I do believe that between the city itself, the health department, and the proprietor, there are ways to basically, while the proprietor can't enforce it, they can, just like a bouncer would stand out there and break up a fight, they can kind of try to work that crowd and get people apart and talk about mask wearing. Inside, while the tables might be 6 feet apart, which is the requirement, and while they may be maintaining a capacity that is 50%, which is the requirement, my understanding from talking to or hearing stories about people that were there is that there were, while that was the case, there are numbers of people crowded, and you're going to expect this at a place like that, crowded up at the bar, hanging out together. There might be a table, and then, people are standing around the table all together. So that, both the people that are going as well as the business can own some of that. We clearly cannot be in every bar, every restaurant, and every other business every day looking at mask wearing and looking at social distancing. So we need some help. We need help from businesses, and we need help from people. So those are the types of things that we could see. I believe the Harper's folks are already looking into how they can eliminate the line outside. I have talked to some folks from East Lansing who are talking about how they might be able to assist with that as well. So those are some of the things that could have been, some mask wearing, some social distancing, the good old things we've been trying to talk about for months now.
Is it the responsibility of the health department to ensure that these enforcement mechanisms, like you mentioned, the bouncer outside, or ideas that could have worked? I mean, is it the job of the health department to ensure that businesses are doing that, or is this an honor system sort of thing?
No, it's just a good idea. I mean, it's like when you say it's a public sidewalk and we don't have any control over the public sidewalk. Well, yeah, I can agree with that. You don't. It's a public sidewalk, but you have somebody standing at the door, so you could use your voice, and hopefully, do some mitigation there. I think, more importantly, what they have decided to do, and more effective, at least from what I'm reading and hearing, is that they are working on protocol strategies in addition to their HVAC system on just, eliminating that line outside. So no line.
All right, that's all for me.
Then we have to be cognizant of what's going on inside as well. So, we hear from restaurants a lot of times that, yes, our staff are wearing masks. I can tell you that I've been in them. I have seen masks on chins. I've seen masks here. We need masks covering a full face. We don't need a mask that's underneath a nose, and we certainly don't need a mask that's just sitting there on chins. So when that question gets answered, we need to be digging a little deeper and making sure that proper mask wearing is happening, not just somebody happens to have one, and that the person in charge at any facility is consistently reminding and enforcing employees that they have to abide by those rules, and wearing a mask below the nose or on the chin is not wearing a mask.
Thank you.
Dave Ackerley?
Hi, Linda.
Okay.
Okay, so we've got 18 cases here you've talked about now tied to Harper's. They cross different health department jurisdictions. Tell me what's going on with contact tracing right now.
So the contact tracing is the responsibility of the health department that the resident lives in. So contact tracing for each of the Ingham County residents happens through us. Contact tracing through the other cases happens through those county health departments. When we identify a person so we'll contact somebody who was a positive, and then they identify others, and one of them happens to be in a different county, then we pass off that information to the other county for them to work, that contact tracing. So we do that. We get in contact with the folks. We find out whether they're symptomatic or not. We let them know their exposure. We inform them that, depending on the number of days they are out from having been at the establishment, that they certainly should go in for testing if they have any symptoms. They should be monitoring for symptoms, and they, symptoms or not, because we have so many asymptomatic cases, can go and get testing. So encouraging them to go ahead and get that testing as well as monitor for symptoms, and let us, and keep up to speed with that. And then the other thing, which, you all have been wondering about ever since, this whole thing started is, do you notify the public? At what point do you notify the public? Well, this is one of those instances where we notify the public. Many of those folks that were in Harper's, and it's over a span of multiple days, it's like, yeah, I was standing next to this group of people, but I don't know who they are. They don't know their names, So when we can't, contact trace to the extent that we can truly identify all of the people who are exposed, and we know there's an exposure event, that's when we issue a press release that tells people that there was an exposure at this place during these dates. And you need to be monitoring for symptoms, getting tested, and all of those things that I just said. So that's where we are now with this public notification.
You gave Linda about an 8-day spread there. Is there one particular day that was highlighted, maybe that the people that you spoke with, the 12 from Ingham County, maybe a majority of them were on a particular day, a particular time, so you know what your window is for, well, maybe we're in the clear on this for the community spread portion? Any idea?
I don't have that information specifically, but I can get it to you. The last window I saw was the 13th to the 20th. So that's a 1-week period. Yeah. So, we're working on that at this point. And some of that has to do with, again, when we run into a case that's asymptomatic, right? The case gets assigned to the date that symptoms began. So for example, if we test somebody on the 20th, right, but they never had any symptoms, then they become a case on the 20th. Well, they may have been asymptomatically positive, the 14th or 15th. We don't know. We don't know until they get tested. And then once the tests come out positive, we can identify the ones who are symptomatic. When did your symptoms start? So, it's kind of with the asymptomatic thing thrown into there, that window is a little bit, challenging. So right now we're in that window and looking to control this. Harper's has been shut down. They're going to continue to be shut down until they get some additional protocols into place, get their deep cleaning done. And then we're going to really start working a little harder with our environmental health staff who do restaurant inspections on a regular basis anyway. They're already incorporating this into now their work with restaurant inspections. At first they thought it was a law enforcement thing, but it's like, no, it's a you thing. But I think, what occurred to me is that this isn't necessarily the nature of the typical work that they do. So we're going to work with them a little bit about, what do you need to be asking about? How deep do you need to dig to find out truly what's going on in a facility about mask wearing and social distancing, rather than just going in and saying, are your employees wearing masks? Yep. That's the end. Okay. I think we have to do a little bit of a job of that, especially when, you've been to them, I've been to them. Restaurants or other places where you, like I said, you see people wearing masks on chins or under their noses or wherever. So we're going to work with our environmental health staff on that.
All right, thank you.
Mm-hmm.
I've got more, but I'll wait.
I don't have anyone else in the queue, so feel free to go ahead.
All right, Linda, I do want to ask you about this. You mentioned we've been other places. Well, what other inspections are going on right now? And have you seen things that would make you as county health officer want to intervene at any of the places since they reopened other than Harper's? Or in the county, has compliance been relatively good from what you have observed?
It's a real mix, Dave. And when I say we, I mean like you, me, people going out to restaurants. I've been out.
Yeah, I got it.
I've got that, as opposed to my EH staff. So our environmental health staff are now back in full gear with restaurant inspections. And then this is going to be incorporated into part of their thing. I'm seeing a real mixed bag, honestly. I drove through this last weekend when I had my granddaughters here. I drove through a fast food restaurant and everybody in there was wearing a mask on a chin. So I let them know that was not appropriate wearing of masks. So I do have concerns. I have concerns when we see what's going on with Harper's, when we know we've had, you know, a close down of Lansing Brewing Company, which there is not anything more has come out of that, which is good. But when you just in general see what's going on, you know, we see pictures of it. We know what happened in Florida where they had to close bars and restaurants after they opened them. It seems to be, and I wouldn't call it a second wave. It's just kind of a leaky spot in trying to keep our this first wave under control. And it does give me concern. And I think, you know, what we try to do is just implore upon bars and restaurants, especially because we're seeing that weakness there right now, but businesses in general, it's like, you know, I get it that, you know, mask wearing is required, right? But there's for public, but they're not going to enforce it, and it doesn't have any penalty or a lot of enforcement actions on it. But businesses, just like they can say no shirts, no shoes, no service, can require you to wear a mask to enter and can deny you entry if you do not. So that is an option for them. I believe that that is a good option for them to choose to take, and certainly would be tremendous amount of help for us in controlling this outbreak or these outbreaks, or continuing to manage transmission of COVID-19. But more importantly for them, you've got small business owners who own some of these smaller restaurants. You have even larger chains that have, you know, now come back into business. And, you know, the economics of what has happened has hurt them. And if things keep going this direction, they run the risk of having to be shut down again. And I would say that it is probably far easier for them to decide to bite the bullet and be a little bit more diligent and about mask wearing by their employees, as well as requiring mask wearing by patrons in order to keep us from having to close down restaurants and bars again.
Thank you.
Go ahead, Rachel Sweet.
Hello there.
Hi.
I'm pretty sure you kind of already answered this, but I guess it's more particular to East Lansing. With one of the biggest bars closed indefinitely or for a while, could you see longer lines at other bars that are still open? And how should the city or owners or even the health department handle that?
Well, again, you know, we are only so many people for this entire county, and we are not every place all the time. We certainly receive complaints. We usually receive them after the fact. We received a complaint about Harper's and the line, and people gathering together at the bar and at tables before these cases were identified. And so we already knew that, and we're responding to that complaint. And so there, I just will keep reiterating that, you know, they want to be hands off and let people come in and do their thing, and think that, you know, it's the bar goer's responsibility to either wear a mask or not, or, you know, stay socially distanced or not. They've done their work by, you know, maintaining capacity limits as they are required, and by spacing out tables as they were required. They can do a world of help to us, to the people of this county who are at risk of becoming ill, as well as to themselves in terms of the risk of their businesses being closed again, by making choices to do more.
Thank you.
Does anyone have any questions for Linda?
Just to confirm, the cases did go up a couple.
Yeah, we were at 14 when the press release went out this morning, and we are at 18 now. And June 12th and 13th were the dates where we had the highest number. So it was really the early side. And then we, you know, just kind of trickled some cases after that. So mostly June 12th and 13th were the largest dates of exposure.
Thank you.
Mm-hmm.
Right, last call for questions for Health Officer Linda Vail.
Do you think this weekend might look a little different, you know, now that this happened in downtown East Lansing for bar goers or restaurants?
Do I think? Yeah. You I hope so. I have communicated with the city manager. I have communicated with somebody on the East Lansing City Council about what they can do. And I've sent this message. I did an interview with one of your colleagues today, earlier. So I've done an interview with Channel 6 and with Channel 10 today, and given the same message that I just gave to you, which is that our bar and restaurant owners, proprietors, small business owners, chain, whatever owners, they do have some discretion in this and some ability to make some choices that will be helpful to us and also will be helpful to them. And I would implore upon all of them at this point in time to do more, to really make sure that your staff are wearing masks over their noses and over their mouths, to really make sure that you can actually, keep people in your establishment, socially distanced to some extent. I understand when you get a place like Harper's is going to be trouble, but then it's like, well, if they're all standing in a big group at the bar, or they've all clustered around certain tables, which are 6 feet apart, but now we have, clusters around the table and empty tables elsewhere, to say you all need to put on your masks or you need to leave. They have the ability to deny entry for things that are not discriminatory. You can't deny entry based on some sort of a protected class or anything like that. But if they can deny entry because I don't have on shoes, I think they can deny entry if I don't have on a mask, if that's what they want to choose to do. I know that there are businesses that are doing it. I've seen them. I've been in them. They have signs on the door, mask required.
Got it. Thank you.
Mm-hmm.
Oh, we have Dave Ackerley with a question.
Okay, well, then you went that direction, so let's go a little bit further. How are they supposed to enforce that with a large number of people when alcohol is involved and their staff certainly has nowhere near the numbers to be able to do that? I understand what you're asking them to do from their staffing standpoint, but from a public standpoint, is it realistic to think that a large restaurant or bar is actually going to be able to enforce that and turn people away without a situation getting out of control?
I haven't been in that environment, so I know they have bouncers and they control all kinds of problems and things in places like that on a regular basis. As far as, again, I go back to, what I've said many times. It's like, we can't create a perfect world. I ask them to do more. I don't ask them to be perfect. Certainly it's going to be easier in smaller establishments rather than a significant establishment like Harper's is. But, to just put it off as that's the bar goer's responsibility rather than accepting some of that and at least making that attempt. I would encourage them to do more.